Hi,
Hello, hello, hello.
how are you? Good evening.
Uh, Good evening. How are you?
Fine,
Fine, thank
thank
you.
you. Thanks for joining us today.
You're welcome.
How's your day been?
Well, it's been a very busy week for me, but hey, it's Friday. We thank God.
That's nice. That's actually motivating. So welcome to our IG Live.
Thank you very much for having me.
All right, then it's our pleasure. And I think we just go right into it because of the time. Yeah.
Yeah, that's fine. Yeah.
All right then. So I'll give a brief intro of our guest. So today we have the presence of Dr. Olowookere. Did I get it right, the
Well,
name?
yeah, absolutely. Well done. Well done.
All right, and thank you. So Dr. Olowookere is an astute medical professional with a keen interest in mental and emotional well-being. Um, he also has a postgraduate degree in public health and a postgraduate degree in psychiatric practice as well, and over 10 years of experience in consultancy, design, delivery, and management of strategic health and mental well-being program across the United Kingdom as well as here in Nigeria. And currently, he runs a psychiatry clinic in the UK and as well as a mental health program for employees here in Nigeria. So we're really glad to have you with us here. And I'm really excited about the fact that you have experience both there in the UK and here in Nigeria. So it's easy for us to make comparison and do try and copy what they are doing there that we can, what's it called?
Implement
Implement
in
here
Nigeria.
and adapt to our own system. So it's really nice to have you here. And
Thank you
our
very much.
topic
Thanks.
for today is promoting kindness among colleagues at workplace. And
Yep.
it's Mental Health Awareness Week, and the theme is kindness. So we're all about kindness this week, and we're really excited about it.
Yes. Thank you very much. Thank you for the very very nice introduction.
Mm,
It's happy to I'm happy to speak to you, and I'm very impressed about what you do
thank you
and
very much.
make an impact and reaching out to people. Very,
Mm,
very impressive. Well done.
thank you very much.
And that's why when you reached out for the partnership, I couldn't turn it down despite my very busy schedule.
Thank you very much.
So personally, I work as a psychiatrist, and I have strong interest in employees' welfare
Mm,
because it's a very busy life that we all live, and there are
mm,
loads of stress maintaining the work and the family. Day-to-day stress of our life is busy,
yeah.
and we tend to forget to take time to just be kind to ourselves.
Mm,
We get overwhelmed with various things going on in the world, and we just don't take that time. So that's my keen interest.
mm,
And like you said, I've been practicing it for the past 10 years, and we have the employee assistant program
mm,
here in the UK. And a few years ago, I thought that why isn't this really popular in Nigeria? Why are companies not really looking after the emotional and mental well-being of their staff? And
mm,
then that was what led to my involvement in Nigeria.
mm.
So focusing on what the theme of this our week of celebration is kindness.
Yeah,
I saw the video yesterday with the coach, very
yeah,
fantastic guy,
yeah.
and he really talked a lot about. So I'm not going to be repeating a lot of
Of
what
what
you
he
have said,
said, yeah.
but I'm going to narrow it down to the workplace and how we can all make impact.
Mm,
So if you look at it, that before we get to the age whereby we're all working,
mm,
we go through primary school, secondary school,
mm,
university, or polytechnic, and then we eventually, or people don't even that are not even educated. Before you can start working, at least you are 18 or
yeah.
thereabout. So the culture of being kind is something that you should have been imbibing from a very, very young age.
Mm,
So my theory is that it starts from the formative years, and we all have a role to play. Parents, uncles, aunties, we need to let the young ones, the kids, to know that be nice to them.
mm.
Let them see that they can make others happy while making themselves happy without expecting anything in return.
Mm,
So little gesture, small gesture of kindness, opening the door for someone or letting someone go in,
mm,
up, saying sorry if someone hurts themselves, being there for people at difficult times and at good times as well.
mm.
But before you do that, you first need to be kind to
To
yourself.
yourself.
and that requires a bit of insight for you to first acknowledge that, first of all, we're all human beings. We should give ourselves allowances to that we could make mistakes, and we should learn to forgive ourselves. The act of forgiveness on its own is kindness. This COVID-19 period has changed our life as human beings, and it's still changing our lives. Coincidentally, the two big religions, the Christians, they've had their Lent during this month. The Muslims, during the COVID-19 lockdown period, so to say, there has been the Lent period and there's been the Ramadan. A lot of people have connected back to their faith. And both faiths really do a lot of talk around kindness. You understand what I'm saying? The Muslim faith and the Christian faith, they really talk about kindness. So if we put this into context and come to the workplace, at the end of the day, everybody's trying to make this money. They're trying to provide for their family, try to put food on the table. So it is very, very important that we see beyond it, we see beyond making work a source of income. We should try and impact lives as well. Be nice to the next person to you. Be careful of the choice of your words, because people are going through stuff. You don't know what people are going through. You don't know what you're going to say to someone that is really going to bring back bad memories or good memories. So if you can't say something nice to someone, it's better you just keep your mouth shut. There's something I heard that my dad used to tell me when I was young, that you should think about before you put your mouth in gear, you need to engage your brain. So if before you say something to someone, you need to think about what impact can this have on someone. Could it be, even if it's a junior colleague, a senior colleague, even if it's someone that is not even is in a totally different social class to you, it does not matter. That should not be a barrier for someone to be kind to each other. So I think something that we really need to be aware of in the work environment. With the way the economy is, there are targets, and people want to show that they are very, very capable and efficient. Exactly, and they tend to forget that there's a role for kindness in this. There's a team spirit here. The team. A lot of workplaces, they do team building activities. They do team bonding. All this is centered around how we behave to each other and how we try to be kind to each other. Just taking a key from my clinical practice, I've seen a lot of people who have been thrown into severe mental illnesses just because people have not been nice to them. Where what I can take, if they say it to me, you might not be able to take it. You might not even recognize that it means it, but it might just spark something in someone, and the person can just break down. And then bring up things. We just need to be extremely, extremely, extremely careful. And it goes back to what I was saying, that if all these have been taken care of right from when someone has been from young age, and you learn that you don't say that, you say sorry, you say excuse me, you say please, you say thank you, all those little things, then it becomes your nature, and you just become kind to people. I don't know if you have any questions, or if you have anything for me to ask me at this point, so that I'll not just be ranting on.
So I'm just like the program you run here in Nigeria about the what's it called, employees' mental health. How has it been going so far, and how many companies, organizations have adopted it? And because I think we all fall into one of the what's it called, options is either you're an employee or you're an employer. So I think it's important for either one to have this understanding to be able to provide provision for the mental support, and the employee should be able to request for the mental support as well. So how has it been for you in Nigeria with the whole program?
In the early stages, I'm talking about three years ago, it wasn't really, the uptake was not that fantastic. We had to do a lot of awareness and telling them that you, as an employer, you have a duty to make sure that the welfare, in fact, that is one of your priorities, to look after your employees. And when you do that, their productivity at work will improve. There will be reduced absenteeism. They will be happier in their job. So when you do that, then you would be looking after them in a good way. But you know, there's still a lot of stigma around mental
Mental health,
illness.
yeah,
So which is
exactly.
exactly, which is the first big thing that we all need to tackle and make people feel normal in talking about their emotions. It's good to feel. It's okay to talk about you feeling sad, and people should not look at people in a strange way if they say they're depressed or they're suffering from mood problems. The same way someone can easily say, "Oh, I've been diagnosed with high blood pressure and diabetes," and people won't look at you in a funny way. People should be able to talk about their emotions and feel comfortable talking about
Talking
it.
about it, yeah.
So the uptake in the first year was very, very low. A lot of people were hesitant in coming out, and they were worried that, oh, is my secret, are my secrets safe
Yeah,
if I talk to them?
confidentiality is a big issue.
Confidentiality, yeah. So we need to really reassure them that there's a lot of confidentiality. It's strict confidentiality. The HR is not really going to hear. Nobody will know. It's just going to be between you
Between
and us. Exactly. So, but the uptake has been fantastic, has been good. But a lot of issues that have come up include stress at work, demands in meeting targets, relationships between bosses and, as in just normal work situation, difficult work situation, lack of flexibility. But COVID-19 has made all of us learn that a lot of work can be done
can
from home.
survive, yeah, it can
Yeah,
survive it, yeah. It's not
yeah.
a life or
So,
death.
exactly. So the uptake is during this period, we've probably seen about 200% increase in demand for our services.
That's really
Talking
good.
out, yeah, supporting a lot of companies around anxiety, how they're going to manage their mood, how they're going to cope with this difficult, challenging situation and the changes in our lives and routine. A lot of people are struggling to sleep. A lot of people are having anxiety about the uncertainties that all this, what is happening. But kindness have a role in all this part. In fact, the fact that the most of these companies are showing their employees that they care about their welfare and they're providing these sessions, it goes a long way to reassure the employees that, okay, the people we are working for, they really care
You
about
care
us.
about
That
it.
is a very, very kind gesture. It gives them the positive vibe that, well, when there's life, there is hope, and they
Yeah.
keep going.
But is
So
it possible for them to take the act of kindness for granted and probably
you mean
misuse it? Yeah, when you show that, okay, we've been kind to you with these, we support you, we're here for you. If you're stressed, if possible for the employee for granted and misuse it.
Yes, we have. It's common. We've seen a few of that. We've seen people, a lot of people, a few people who we call it malingering. That
Malingering,
there's
okay?
actually there's actually nothing really wrong with them, but they are probably using it as an excuse
Escape.
to look for some escape route. Or yes, we see that, and we 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 as professionals, we can assess and decipher and say, okay, there's really not no stress or no emotional
Yeah.
difficulties, and we'll be able to address the person appropriately. That why do you think this needs to be your approach to things? You understand what I'm saying? Why do you think you need to take advantage of this kind of things to get whatever you're trying to get? We'll just let the person develop inside. It's good that they're coming out to speak to us. We will do the assessment and then we'll be able to recommend whatever intervention that is necessary. So the fact that people can take kindness for granted should not discourage people from
Providing the
showing
service.
Exactly.
And for us, with the stigmatization around mental health, yeah, have you had cases or are there situations where, okay, an employee comes to you to confide into, he has mental health issues, maybe probably because of the severity of it, he's been laid off work. So when the employee comes with an issue of mental health, is it the employer's job to take care of him, or how does it work?
It depends. So the way we run it is you could refer yourself if you think you're struggling with your emotional problem.
Okay.
Or the HR could refer you. if they think there's some problem here. So if an individual has referred themselves, then we don't have any reason to speak to HR. We'll continue to support the person, and HR is totally out of the business. But in situation whereby HR, the concern about the mentor's welfare was raised by a manager or someone at work, and then they refer, we would assess and we will still keep it confidential. We're not going to go back and tell HR that this is what is the problem or this. No, that's not what we're going to do.
So their job won't be at stake.
It should not be at stake in the ideal setting, because
What
they should
is
be supporting them. That's a very tricky question. Well,